Let me feel your skin.
Ah, well,
You weren't expecting that.
Cold hands, by the way.
I know.
But it felt nice.
But, you know, the cold weather can really play havoc with
your skin.
Okay,
That would be inappropriate.
No, it's not. Because people get dry skin in this weather, lack of hydration, many problems with the skin.
All right, all kinds of flaking, you know,
yes,
unpleasantness. Flaking. It's terrible. Gosh, skin is really kind of losing no matter what, in the wintertime and in the summertime.
You're right.
All right, skin, it's our largest organ. Literally, the skin is an organ, and I sure hope that's right. We've got a dermatologist sitting on the couch. Her name is Dr. Doris Day. That's really cool, by the way.
No relation to the actress, right?
No relation.
Okay.
Doctor, we had you to come.
Immigrant parents with a sense of humor.
Really?
Yeah.
Really? That's the truth?
That's it.
Immigrant from where?
Iran.
No kidding.
Yep.
All right, so we had you to come in because a lot of people are suffering right now because of the cold weather. It's apparently damaging their skin. What do you recommend?
Well, what happens is that when the weather gets cold, there's more moisture in your skin than the air, so the moisture gets pulled out of your skin. It can leave it dry, itchy, and dull looking. So it is really important to hydrate very well. There's another condition called keratosis pilaris, which occurs on the outer part of the arms. It's red, it's bumpy, it's genetic.
It's like a lot of little pimples.
Exactly, and it's genetic, and you can't cure it, but you can help control it with the right moisturizer. So I'm a big drugstore girl, and I'm always in that drugstore looking for the best products that are reasonable.
Right, you don't have to spend $50 or $100 on the products.
Exactly. So one product I like specifically for dry skin is called Amlactin Ultra. You could help smooth out the redness, moisturize your skin, and it gently exfoliates to get rid of that extra layer that needs to slough off, but without drying your skin. And the itch also really gets better.
So you're a spokesperson for this particular brand, right? How much do these usually run in the drugstore?
About anywhere from 10 to 15 bucks generally.
And it has a little something in it that kind of makes you flake off the skin?
It has some lactic acid and alpha hydroxy acids that are very gentle, and they're designed to help gently exfoliate, but they're also humectants, which pulls water into the skin. And that's very important because you want to lock that water in the skin. And the most important time to moisturize is right after the bath or shower when your skin is still damp.
Do you do that?
Because that's when you get it in. So leave it in the bathroom.
When do you moisturize?
I never moisturized. I use, like I said, either Irish Spring or Dial soap and a razor blade. But I know sooner or later, you know, I got to start thinking about
we have to talk.
Yeah, he uses the deodorant soaps, which usually are very drying,
Exactly.
Right?
You want to switch off that too for the winter. And also no long hot showers. You want to kind of switch it off.
The bath? You recommend the bath?
10 to 15 minutes, not too hot, not too long. Pat dry, moisturize.
What other conditions do we see during this time?
So psoriasis is another condition that's genetic, so we can't cure it, but we can help control it. And sometimes with the dry winter air, it can get worse. That looks like red patches. And sometimes I have patients come in, they have one spot on their leg, and if it's a woman, she won't wear a skirt, won't go on a date, and it can be debilitating, and it can affect other organ systems as well. If you have psoriasis, we typically use topical cortisone, but there's a whole new category of drugs called biologics that really help control this condition. So there is hope if you have it, and especially if you have joint ache, see your doctor. There's so much that can be done to help with that.
Now, Doc, I have rosacea.
Yeah, but nobody would know. Your skin is beautiful.
Well, that's because I have about 10 pounds. It's not contagious. It's about 10 pounds to make makeup on it.
Yes.
I know.
Rosacea is interesting because it's something you grow into in your 30s and 40s, and it's at a point where we're kind of unhappy if we break out, but also we want anti-aging ingredients as well. So the things that can trigger rosacea: alcohol, stress, spicy foods, extremes in temperature, which we see in the winter. So you can control those to some extent. But I also look for drugstore products for this, and I love Olay Pro X for women with rosacea.
You know, a lot of people say those Olay products are very good for you.
They are tried and true. And
as in oil of Olay?
Yes.
Oil of Olay, but this is the Pro X line, and it has niacinamide, caffeine, and retinol, so it's multitasking to anti-age. And I do like retinols for people with rosacea, but it has to be done carefully.
What about Calgon? Remember Calgon? Calgon, take me away.
Yeah,
does that stuff
drying.
work?
Yeah, it is drying. You want to be careful with the bath.
What
products.
about Epsom salt?
Epsom salts, I think, are like the cure-all for everything.
Yeah.
But you have to, I mean, it'll clean your house, it'll clean your feet, it'll do a whole bunch of things.
It works?
Again, it can work, but you have to just titrate how much of it you use.
We don't want to ignore the feet, apparently.
Oh, yes, the feet, because he doesn't put anything on his feet.
Okay, so for the foot, you can give yourself a little foot facial. And what you do is just soak your feet in water for 5 to 10 minutes so you get water in, and then that Amlactin Ultra comes in handy. You can put a nice thick coating of that, a little plastic wrap, and then a sock. And if you do that every day for a week, and then once or twice a week, your feet will be baby butt soft and smooth. And that's never a bad thing.
That would be nice.
I don't want it feeling like a butt.
Well, that's soft and
Sorry,
smooth. Don't take that visualization too far. But it does feel nice and soft and smooth because dry, cracked heels can be painful and itchy.
I have trench foot. Seriously, I've got like right. No, I mean I got horrible feet.
There's a lot you can do.
I know that another topic you wanted to talk about today is ingrown hair.
Yeah,
is that a winter problem?
It can be a winter problem, although we tend to wax.
This guy has no hair.
Is that
He looks like G.I. Joe's physique.
Yeah, so waxing will create more ingrown hairs than shaving. So if you have a lot of ingrown hairs and you wax, try switching to shaving. If you have dark hair and lighter skin, then laser hair removal solves it because it gets rid of the follicle and then you just don't break out. So that really helps as well. And you know, if you have puffy eyes in the morning, we're big onto home remedies.
Yes, puffy eyes.
Yeah, so for puffy eyes, one of my favorite recipes is one that I made up and it really works. You brew a pot of strong white tea, because white tea has the most antioxidants and the most caffeine, and then you add 2 tablespoons of honey, ideally dark organic honey, let it cool to room temperature, add cucumber slices, and refrigerate.
Oh,
that'll
boy.
last you a whole week. So you just make it once on a Saturday.
And what do? You paint it on your head?
So then you just take a couple of cucumber slices, put it on your eyes. You will feel that depuffing, and it's soothing and relaxing, and it's easy.
That sounds awesome.
Yeah, and it works.
It sounds like
Guys are not going to do this.
You got to go
Women
get a
will do this.
cucumber first of all. That's,
You know what? Those fruit stands on the street, they're so accessible.
here's
and
what I'm
they're
going to do. I'm not going to shave on the weekends, all right?
Okay.
Because that is for the guys.
Yeah.
Actually, I read that in GQ about 10 years ago. You let you lose the ingrown hairs, or you let them like kind of bust through the skin.
You're right, because when you have curly hair, the hair grows out and then it curls and grows back into the skin. So when you let it get past that point, then you get less, that's called pseudofolliculitis, because it's not really an inflammation, it's the hair poking back into the skin.
Why did you choose dermatology?
Oh, because, you know, as a dermatologist, I make people feel good. It's about self-esteem. And if I tell someone to quit smoking, they'll quit because they don't want the wrinkles around their eyes. Everything I do is about helping people look and feel their best, and that's what gives us the most satisfaction as doctors. There's no shortcuts to the skin.
She's good.
Everything you do shows.
She's good. Dr. Doris Day. Que
Yes.
sera, sera.
Love it. Love it.
Thank you, doctor.
Thank you.
Thanks for having me.